Hello and welcome to Health Talk. My name is Carrie, and with us today is Mary Faye, a registered dietitian and certified diabetes educator. Today we're going to be discussing diabetes prevention. We've been talking about diabetes on our previous shows and that it's the fastest growing chronic disease in our country. Today we're talking about diabetes prevention. What are the risk factors for developing diabetes?
Well, there are a myriad of risk factors. Some are modifiable, some are not. One of the major factors is family history. So genetically, there is a predisposition for diabetes. The other is being overweight, and we are calling it actually a diabesity epidemic, with obesity being one of the major factors in the development of glucose intolerance or elevated blood sugars. Also, a sedentary lifestyle. We Americans have really have buttons to push for everything. So a sedentary lifestyle contributes to the development of diabetes. Also, there are other risk factors that indicate that there is diabetes or increases the risk, and that is high blood pressure or hypertension, elevated lipid levels, cholesterol, and triglyceride. Also, polycystic ovarian disease, particularly in teenage girls, is an indication that there is insulin resistance.
How many Americans have prediabetes?
Prediabetes, which is an indication that a patient is at risk for developing true type 2 diabetes, are 57 million Americans and 2 million children. 1 out of 14 children, particularly if they have the risk factors we just mentioned, are at risk for developing diabetes and are considered having prediabetes. And as I mentioned, 57 million Americans.
With the high incidence of diabetes and prediabetes, how costly is this disease?
This disease is a very expensive disease, not only for the healthcare costs, but also the loss in productivity, the absence rate, and the other complications. It yields a cost of $25 billion a year in this country. It's actually a third of the Medicare budget.
How is prediabetes diagnosed? Should a patient ask their doctors for these tests?
Prediabetes is diagnosed when a physician does a blood test for blood glucose levels, and the levels come in at 100 to 125. Above 126 or above indicates true type 2 diabetes. So that is an indication that there is some glucose intolerance going on and that the patient is at risk for it. Also, those other factors of a high blood pressure, high cholesterol, high triglyceride indicates the patient has what we call syndrome X or prediabetes.
Can you review again the terms impaired fasting glucose and impaired glucose tolerance?
Impaired fasting glucose is when the physician does the blood glucose test without a patient consuming any food for 8 hours, and that's when the level comes in at 100 to 126. If they have impaired glucose tolerance, the test has been done when a patient has consumed a meal, including carbohydrates, and the level comes in at between 120 and 140 post-meal.
What are the changes someone can make to lower these blood glucose levels and prevent the delay or onset of type 2 diabetes?
The changes are a lifestyle change, and this is different from the way typical Americans live their life, but it includes reducing the body weight to at least 5 to 10%. Already that will begin to bring those blood glucose levels down. And that loss of weight is affected by a change in diet, reducing the total calorie intake by not consuming as much fast food, pizza, high-fat fried meals, including more fruits and vegetables in the diet. The typical American consumes 1 serving of vegetable a day, and so increasing fruits and vegetables to at least 5 a day. Also having lean meat choices as opposed to sausage, hot dogs, French fries. Also including low-fat dairy products, such as skim milk or 1% milk as opposed to whole milk. So diet changes are a big part of reducing that weight and decreasing the risk for diabetes. The other is including at least 30 minutes of physical activity 5 days a week. 7 is better, but at least 5 days a week of some kind of aerobic exercise with some strength training. Now, if I have patients say, if I can only fit in a half an hour, what should I do? Walk. And walk not at just a very sedentary or slow pace, but at least 3 to 4 miles an hour so that you are getting your heart rate up. If someone cannot carve out 30 minutes a time in their day, then even 10 minutes in the morning, 10 minutes at lunchtime, and 10 minutes in the afternoon is a way to still get in the 30 minutes of physical activity. If you're waiting for a meal to be prepared, engage your muscles, tighten them, count to 10, and release, and do that 10 times. If you are impaired in being able to walk or be physically active, or now that we're heading into seasons where there's ice and snow, go to the mall and go walking, or chair exercises. There are shows on television that help you work through an exercise program. So diet and physical activity are two of the biggest factors. And for our children, decrease screen time. Sitting in front of the television, the computer, doing video games actually reduces the metabolic rate by about 10%. So they're burning fewer calories while they're sitting in front of the screen. That actually holds true for adults as well. So the lifestyle change is the biggest factor.
Has the research shown benefits to these lifestyle and behavior changes?
Absolutely. In fact, there have been studies where a patient who was significantly overweight, BMI greater than 35, who had all of the risk factors, high blood pressure, high triglyceride, high cholesterol, and after following a diet, as I previously mentioned, watching processed foods and exercising, within 28 days reduced their blood glucose level by 30 points. So we know that the outcome data shows that it is effective, and these are goals that can be accomplished.
Are there any medications used to prevent or delay type 2 diabetes?
There are. Many physicians now are prescribing metformin to preserve the pancreas. The pancreas is the organ in the body that produces insulin, which is the hormone that helps control blood glucose. And we know with prediabetes that insulin resistance is happening, where the insulin in the body isn't working effectively, so there's lack of insulin sensitivity at every cell site, as well as the pancreas not producing enough. So metformin helps to preserve the pancreas and that insulin, which then delays or prevents the incidence of type 2 diabetes.
Are these same risk factors and guidelines used in children?
They are. The same reduction in blood glucose levels to less than 110 as pre-meal, as well as a reduction in the cholesterol and triglyceride, and reduction in the other factors that indicate that there's insulin resistance.
Can we summarize the risk factors?
The risk factors for development of diabetes are age, anyone greater than 40 years of age, anyone who lives a sedentary lifestyle, gets very little exercise, anyone who is in an ethnic population that develops diabetes at a greater risk than others are Asian Americans, Native Americans, and Hispanic Americans. The others are being overweight, a BMI, body mass index of greater than 25, any indication that insulin resistance is happening, high blood pressure, high cholesterol, high triglyceride. For females, polycystic ovarian disease. These are all the risk factors that you really should be speaking with your physician about.
Are there resources available for people who are concerned about prediabetes?
Yes, there are some wonderful websites that are available. The American Diabetes Association has a great website that teaches the layperson about diabetes, all the different types, the risk factors. There actually is even a little online test that you can take to find out if you are at risk or someone in your family. The website is www.diabetes.org. So that's a very reputable site. Another great website is the American Association of Diabetes Educators, AADE.org. Also, the American Dietetic Association has a great deal of information about diet and nutrition and diabetes, and that website is www.eatright.org. Another one that has developed over the last 10 years that is very consumer-oriented is called dlife.com, and they have recipes and a lot of helpful information for those who want to begin to change their lifestyle and eat properly, and types of exercise that are beneficial. Another great resource for diet and how to decrease your risk for prediabetes as well as heart disease, because we know those who have diabetes and even prediabetes are at greater risk for developing heart disease, is the National Institute of Health's DASH diet. It was developed for dietary approaches to stop hypertension, DASH. And if you Google DASH diet and select the third selection, which is eating plan for the DASH diet, it is a wonderful resource of the lists of foods of those that are recommended. On page 13 or 14 is actually a chart you can print, take with you grocery shopping that indicates the fruits, the vegetables, the nuts, the types of oils that should be purchased, and it follows with recipes and other resources. Another great website is the Prevention Magazine has a wonderful website called www.prevention.com, and the other is webmd.com. And you can just type in the search bar diabetes, prediabetes, and you'll see a great deal of information as well. So there are a variety of internet sites, and of course we always offer that they can call the hospital for additional information to my phone number or Barb's, and that's 375-6271 or 375-4127, and that's area code 716. But you do want to be careful about the resources on the internet.
Well, how do you know that the information that you're reading is accurate?
You want to make sure that the resource has certified diabetes educators and registered dietitians and physicians, medical doctors who have a specialty in nutrition and diabetes. The term that you would look for is endocrinologist for a physician. But those are the credentials that you would see from those who use scientifically based information based on research trials that have been done, and it isn't questionable or a temporary 6-week diet to lose weight, that their information is based on science.
Okay. Well, thank you, Mary.
Thank you.
That's all the time we have for today. For more information on diabetes prevention, please visit us at www.ogh.org. Thanks for watching, and we'll see you next time on Health Talk.